If you have prostate cancer or a risk of it, you are likely not a good candidate for testosterone replacement therapy because some studies indicate it could exacerbate or promote this condition in men with such physiological propensities. One example of ADT, androgen deprivation therapy, is surgical removal of the testicles. This will drop testosterone levels by more than 90% in 24 hours. Another way to block testosterone is with drugs. In a study published in the journal Clinical Genitourinary Cancer, researchers looked at the testosterone levels of men being treated for prostate cancer with an ADT medication after 6 months. Of 153 men, 25 were found to have a testosterone level less than 20 nanograms per deciliter. However, this entire theory of testosterone causing prostate cancer has recently come under increasing scrutiny. The initial study that produced this hypothesis was conducted in the early 1940s by Dr. Charles Huggins and was severely flawed. Furthermore, young men are jam-packed with testosterone, yet their levels of prostate cancer are, at best, minuscule. How could testosterone be linked with prostate cancer when men between their teens and late 20s are fountains of testosterone? Prostate cancer is a lot more complicated than previously thought, as modern science and medicine make breakthroughs in the understanding and treatment of the disease. Older men, on the other hand, have far lower levels of testosterone circulating in their blood. Yet their rate of prostate cancer is many times more than young men. The debate goes on, and there is a conflicting belief in the medical community about testosterone and prostate cancer. If you are a male inflicted with type 2 diabetes, you probably suffer from low testosterone. Contact us today to learn about symptoms and the treatment. Are you an over 45 male and have type 2 diabetes? Are you having trouble with your sex life? The problem could be low testosterone. We can run tests to determine if, in fact, low T is one of the factors. We can also check other hormone levels like IGF-1 to see if you are deficient in growth hormone. There are some tests in an advanced blood panel to determine where you might need medical help and treatment. Testosterone is the main male sex hormone, and it's essential for maintaining healthy sexual function, strength of muscles, mood, and energy level. If you're experiencing any of the following, you should see your doctor. Problem of a sexual kind. You may find yourself falling asleep in the evening. You may notice a decrease in your muscle size and a shortening in the endurance of exercise. Have you suddenly felt sad or have lost interest in life for no rational reason? If you recognize any of these symptoms, contact us. We will check your testosterone level with a simple blood panel. Quote, "It's not clear whether one causes the other," end quote, explains Dr. Feining. Quote, "Research shows that men with low testosterone are more likely to develop type 2 diabetes. Testosterone increases insulin effect/response, so logically, low testosterone can cause an inadequate response to insulin, and diabetes is a disease in which the body does not produce or properly use insulin." End quote. In one study conducted recently, 58% of young males were found to have low testosterone levels, and all of these males were obese. In addition to considering TRT, the best thing you can do to manage or prevent low testosterone is to control your type 2 diabetes and shed pounds. If you are found to have low testosterone, our medical clinic can prescribe treatment options, including testosterone replacement in a gel, patch, or injection. 12 million American males are diagnosed with diabetes, and most people are unaware of the link between diabetes and low testosterone. They may be suffering in silence from low energy, constant tiredness, and sexual problems, but fail to discuss these issues. The same recent survey found that 60% of the men felt they needed more information to manage their diabetes better. The ADA thinks that as many as 13 million men have low testosterone levels. Sadly, 90% of them go untreated. Don't be one of them. Do you have type 2 diabetes? Are you overweight and over 45? If so, you need to be aware of the symptoms of low testosterone. Contact us and get informed. More health problems associated with low T. Complete loss of libido, impotence, severe ED, tender and enlarged breasts, osteoporosis, depression, hot flashes, weight gain, anemia, high cholesterol, mood changes such as irritability or sadness, loss of morning erections or other erection problems, low energy and easy fatigue, loss of muscle strength or bulk. The answer is straightforward. Contact us. Low T may not be your problem, but then again, perhaps it is. We can provide the professional, precise testing to determine if you do indeed have low T and if you would benefit from TRT. Your treatment will be done professionally and safely. If you found this video informative, please press the like button and subscribe to the channel. To learn more about health and wellness regarding testosterone replacement therapy, please click the link below in the description.